Good morning. Good morning. Let me just close the door behind me. Welcome. My name is Dr. Ross Kopelman. I'm a hair transplant surgeon based out of New York City and Palm Beach, Florida. And today we're going to be talking about hair loss and hair transplants. So if you're joining for the first time, do not hesitate to ask questions because I love being able to answer your questions as it pertains to hair loss and hair transplants. I spend all day from the moment I wake up in the morning to the time I go to sleep talking and dreaming about hair loss. So if you're joining for the first time, welcome. Do not hesitate to ask me any questions that you want about hair loss. We're going to start off the conversation by talking about the number one cause for hair loss. And the number one cause for hair loss, believe it or not, is genetics. That's either your mother's side or your father's side. Hair loss is polygenetic. It can impact either side of the family tree. And the reality is we can't avoid our genetics. Genetics is not avoidable. But what we can do is if you are more sensitive to a hormone known as DHT, dihydrotestosterone, that is absolutely what we can combat against. So the first thing that we have to do is talk about hair loss medications. And the most important medications to talk about are finasteride and dutasteride. These medications are DHT blockers. DHT is dihydrotestosterone, and that causes a miniaturization of hair follicles. Now, the reality is there's only two drugs at our disposal that are really good for hair loss. That's finasteride and dutasteride. And both of these medications are critically important to combat the miniaturization of hair. So finasteride decreases DHT by about 60%. Dutasteride does it by 90%. So can you imagine which one I think is going to be more impactful to address hair loss? Dutasteride. Okay. And that's something that you should understand. If you're joining for the first time, welcome. My name is Dr. Ross Kopelman. I'm a hair transplant surgeon based out in New York City and Palm Beach, Florida. And I love answering questions about hair loss and hair transplants. Is TRT replacement bad when we have problems with hair loss? So when you're doing hormonal replacement, you're increasing your testosterone levels, and testosterone converts to DHT. So it absolutely contributes to hair loss. There's not a question in my mind whether it contributes to hair loss. It does. But what are you supposed to do during that period of time? Because you might need the hormonal replacement. Continue the hormonal replacement, but think strongly about being on DHT blockers. Dihydrotestosterone is going to miniaturize the hair. So finasteride and dutasteride are going to be important to prevent that conversion from the testosterone to DHT. I hope that answers your question. Good morning, House of Ann. Good to see you. Welcome, welcome. It is 8:38 a.m. in the morning. I'm doing a nice, quick 1 hour live with everyone today. So if you're joining for the first time, welcome. House of Ann is one of our amazing community members. We're very thankful for her to be part of this community. And I want to thank everyone who's joining this morning, watching me live as we talk about hair loss and hair transplants. This is very, very rewarding. 5:38 in the morning. Wow. Okay. Well, I'm glad I'm the first thing that you're seeing in the morning. First person that you're seeing in the morning when you wake up. It's nice to see you. Okay. So if you have any questions about hair loss or hair transplants, do not hesitate to ask me in the comments below. And thank you so much for joining my fan club. And we love having you part of this. Okay. So number one cause for hair loss we know is genetics. Number two, if you have genetic propensity, what do you think of low dosage fen with topical dutasteride? You mean finasteride and topical dutasteride? That's not a bad option. So sometimes I do have patients on oral finasteride. And finasteride, you can microdose the drugs. You don't have to necessarily take them every single day of the week. And then what you can do is you can use a topical dutasteride. And I like a topical dutasteride from a company called Xyon, XYON. It's a great topical. Is 3 PRP treatments enough 3 months after a hair transplant? So when you think about PRP, that's platelet-rich plasma, and that's where we take blood from you. We spin that blood down, we isolate growth factors, and we inject them to the scalp. You must think about PRP like Botox injections. It's never a one-time treatment. You can do these treatments spaced out, but you have to be consistent. I do like mesotherapy better, MESO therapy. I do mesotherapy in my office, and I find that to be a much more effective option when it comes to addressing hair loss. So that's a really good question. If you're 17 years old and you're starting to experiencing thinning, Sala, this is the time to start addressing it. It's not too late to start going on medications like finasteride or dutasteride. These are DHT blockers. And then, of course, I like oral minoxidil or topical minoxidil, but I really like oral minoxidil better because it's just taking a pill. It's really that simple. What minoxidil does not do is minoxidil does not prevent hair loss. Minoxidil will thicken that hair follicle. It will prolong the anagen growth phase. But if you were taking minoxidil alone, I can almost guarantee you that's not going to prevent your hair loss long term. You must think about being on a DHT blocker like dutasteride or finasteride. These are oral medications or natural things like saw palmetto, rosemary oil, pumpkin seed oil, which are, by the way, in our shampoo, which has natural DHT blockers, as well as in our hair serum. We have natural DHT blockers in here as well. Saw palmetto, rosemary oil, and pumpkin seed oil. And when you use these in combo, it works really well. You put this on 30 to 60 minutes before a shower, and then you put this on after. If you're joining for the first time, welcome. My name is Dr. Ross Kopelman. I'm a hair transplant surgeon and a hair loss expert based out of New York City and Palm Beach, Florida. I do virtual consultations with patients really across the country and really around the world. I have patients in Dubai, Australia, the UK, Canada, and the list goes on and on and on. If you're joining for the first time, I welcome you because RootMD is the fastest and largest hair growth community in the world, which is quite amazing to say. We started this community about 10 weeks ago. Over 15,000 members. So it's unbelievable. If you're joining, please ask me as many questions as you want. This is your opportunity to ask a hair transplant surgeon any questions about hair transplants, hair loss. I treat 50% of my patients are female, 50% of my patients are male. So I can answer any questions as it pertains to hair loss. And I want to thank the person who just purchased the RootMD shampoo. We're so thankful to you. Okay, is finasteride Monday, Wednesday, and Friday 0.5 enough? So that's microdosing the medications, and I sometimes do that. In fact, I microdose finasteride. Okay, why? Because I can't take a daily dose. So if I take a daily dose of finasteride, I get inner groin pain. Okay, side effects are real. They can happen. They don't happen to everyone. But yes, when I microdose the drugs, side effects go away, and the benefits still maintain because we know that these medications stay in your bloodstream for prolonged periods of time. Occupation ends. I use Rogaine foam. Can I put RootMD in addition before showering? Yes. So what you would do before you shower is you put on the hair serum, you leave this on for 30 to 60 minutes, and then you wash off with the RootMD shampoo. You leave this on for 2 minutes in the shower, and right before you go to sleep, when your scalp is dry, then you put on the Rogaine foam. That's basically the regimen that I would recommend following. Yes, I am a doctor. I'm a hair transplant surgeon. Just finished PRP. When can I start mesotherapy treatments? You can start mesotherapy treatments whenever you want because mesotherapy uses dutasteride at my office, as well as sometimes minoxidil. I like mesotherapy better. In fact, in my office, I charge the same amount for PRP and mesotherapy. I make more with PRP, but I tell 99% of my patients to do mesotherapy. Why? Because there's a tremendous amount of variability when you go for PRP. Yes. If you take your blood on a Monday versus a Friday, different levels of growth factors. So critically important for you to understand that. It doesn't mean that PRP doesn't work. It just means it's not as effective as mesotherapy. And I like to save patients money and give them the biggest impact when it pertains to their hair loss. So another great question came in. Hair thinning, female pattern baldness, menopause, HRT, other modalities, we necessarily don't want systemic estrogen. Okay, so if you're female and you're going through menopause, guess what? Your estrogen levels go for a nosedive. Okay. Estrogen is usually protective for hair loss. Think about a female who is pregnant. Their hair gets very luscious and beautiful, but during menopause, goes for a nosedive. So, number one, your androgens are going to flare. You're going to be more sensitive to DHT and miniaturization. And if you add hormonal replacement therapy onto the mix, well, guess what? You're adding exogenous testosterone and exogenous hormones, and that's going to contribute to further miniaturization. So for menopausal women, I put them on DHT blockers. Dutasteride is my preferred, sometimes finasteride. I like oral minoxidil because that will help thicken the hair, and I like to add a topical dutasteride. That's really the combination that I follow, and I think that is the most effective. And I treat a lot of females who are postmenopausal or who are currently in menopausal for hair loss. Okay, what other great questions does everyone have? By the way, where's everyone calling in from? More than happy to answer any of your questions about hair loss or hair transplants. Yes, this does have rosemary oil, pumpkin seed oil, and saw palmetto. All three of these DHT blockers that we have in our hair serum and in our shampoo are backed by research. Okay, so we know that rosemary oil is as effective, for instance, as 2% minoxidil. Okay, that means it's going to help improve blood circulation to the scalp. It's going to help prolong the anagen growth phase of the hair, and rosemary oil acts as a natural DHT blocker. Okay, what are the chances of my temples receding after a transplant, even if I'm on finasteride? Well, if you go for a hair transplant, the idea is that they address your temple areas, and being on medication slows the process down. It doesn't mean that it's completely resistant to hair. It's not completely resistant to thinning. It slows the process down. Can topical dutasteride cause a dread shed? I've been on topical dutasteride. I have not had a shedding. What I experience with my patients, Dark Sister, is patients who come in with a condition known as telogen effluvium, excessive hair shedding. They're the ones that, if I put them on medication, their shedding accelerates temporarily. If you have androgenic alopecia, gradual hair loss, I don't typically see any shedding that occurs. Glam by Trevor. I'm not familiar with Procel, but I will look into that. And next time I'm here live, I'm more than happy to answer those questions. I don't want to give you a false answer without having the insight. What do you apply in meso? Growth factors. So in mesotherapy, we use dutasteride, and we know that dutasteride, House of Anne, decreases DHC by 90%, and that's why I think it's very good. Doctors, 2 milligrams of minoxidil each day enough for hair growth. So for male patients, I put them on 2.5 milligrams of minoxidil. Female patients, I put on 1.25. That means you cut the pill in half. You can always increase the dosage, but that basically is the appropriate dosage for a male and female patient. Okay, what other great questions do we have? This is really good. You've been asking me amazing questions, so I'm so thankful for everyone who's joining. Oh, amazing occupation ends. I'm so happy. I didn't realize that you had our shampoo already. I hope you get to try our hair growth serum. And if you ever needed a consultation with me, you can always reach out and book a virtual consultation. My consultations, by the way, cover you for entire year of care. So that means that if you need me, I'm essentially available 24/7, which is an unbelievable service, because I don't know anyone else who offers that level of concierge care to patients. Are women given lower doses of minoxidil due to side effects? Well, we know that you can get swelling of your legs, okay? And so that's one of the reasons why we put women on lower doses. They can go on higher doses, but it's always better to start on lower doses. What has less side effects, minoxidil or finasteride? Well, one would argue that for a female patient, I'm not really concerned about side effects from finasteride or dutasteride. The only thing to look out for is an underlying anxiety or depression. For men, they're worried about libido, erectile dysfunction, gynecomastia, inner groin pain. I mean, but the thing is, when you microdose finasteride, you don't see these side effects. And same with minoxidil. The only side effect women are concerned about with minoxidil is unwanted hair growth on the face, but it's uncommon. You're not going to grow a beard, females, and men. There's really nothing to worry about with minoxidil. That's the truth. Some other great questions that are coming in. Will using a hairbrush shampoo help stimulate hair follicles? You know, anything that you do here to stimulate a motion of your scalp is improving blood circulation to the scalp. Now, you'd have to be very aggressive, constantly doing this every single day. You know, if you use a brush that's too harsh, or you're pulling hair follicles, it's something to be very cautious about. So that's essentially the story there. Yes, you know, doing head massages can help potentially improve hair loss, but it's not a critical thing. It's not at the top of my pyramid. Hi, doc. Should I use natural or pharmaceutical approaches to growing thick hair, increasing hair count? Should I use finasteride every day, or use it alternatively with topical dutasteride? You're asking me a million questions, and those are really good questions. And let me break it down for you. At the top of my pyramid, the most effective way to address hair loss is with a DHT blocker. That's dutasteride or finasteride. Those are going to be the best drugs. If you're worried about side effects, you microdose, and I can almost guarantee you're not going to have side effects. Oral minoxidil is the next drug that you want to consider putting in your regimen, because that's going to thicken your hair. And then, of course, you can think about doing other things. Using topical dutasteride from a company called Zion is an amazing option. And then there are natural ways to stimulate hair growth. Washing your scalp more frequently is very important. So the more frequently you wash your scalp, the better, actually. I wash my scalp every single day, but a minimum of once every 3 days. You can consider using the Root MD shampoo. This has natural DHT blockers in it. It's good to have something like this in your routine. I will never tell you a shampoo alone is going to address your hair loss because that is false, but having the right shampoo with the right ingredients is a good thing. And then, of course, there are other natural things you can think about. You can think about using a hair serum. You can think about doing red light therapy. You can think about doing pure P and mesotherapy. So there's a lot of different treatments, and that's basically why going to someone who's an expert, who understands hair loss, who can guide you through the process, who can look at your hairline, who can look at the type of hair loss you're experiencing, who can. That is essentially what I do. I am constantly doing consultations with female patients and male patients from all over the place, virtually and in person, to help them figure out exactly what type of hair loss that they have and help them figure out what the best treatments are. What about the psych side effects of finasteride? I'm scared. Yeah, there are patients who are afraid that if you have an underlying anxiety or depression that these can heighten. But Willow, if you microdose these drugs, you're not going to have any side effects. They become very, very rare. So that's basically something to keep in mind. Have you had a hair transplant, or do you personally use the products? I use all the products, Cassandra. I use the Root MD shampoo every single day, and I use the hair serum a couple times a week. So I do everything that we've developed. I use. I also use hair loss medications as well. And no, I've not had a hair transplant, at least not yet. Maybe in the future I'll have a small one to repair this, but I'm happy. You only go for a hair transplant. Surgery is the last resort. It's not a first resort. You go for a hair transplant only when you think you need to address something because it bothers you. Are dermatologists hair loss experts as well? Insurance may only cover dermatologists versus a specialist like you. Dermatologists, unfortunately, are very, very poor at addressing hair loss. I know that because my sister is a dermatologist, and she told me that all of her colleagues are very, very poor at addressing hair loss. A lot of dermatologists think that Nutrafol is the only answer, or just Minoxidil. They're afraid of finasteride or dutasteride. So be my guest. If you want to go to a dermatologist, go. But if you're going to go to a dermatologist, make sure it's someone who is an expert in hair loss. If they're not an expert in hair loss, they're going to do a very poor job at addressing your hair loss. I can almost guarantee that. So that's a really good question. What is better, daily red light therapy or daily scalp massages? Red light therapy. Red light therapy is better. We know that red light therapy with 650 nanometers of red light is going to be very effective at addressing hair loss. But the problem with the red light therapy is you have to be consistent. These helmets can be expensive. You have to wear them routinely. I'm not opposed to red light therapy. In fact, I like red light therapy for certain patients. If you don't want to use medications, if you're pregnant, you're breastfeeding, there's a lot of different reasons to use red light therapy. Really good questions. I'm thankful for everyone. For everyone, everyone who's asking questions. So really good questions that are coming in today. So thank you so much. If you're joining for the first time, I want to welcome you. Root MD was started by myself, my sister, who's a dermatologist and a hair loss expert, and a patient of mine, Maris, over the summer. And we have grown to over 15,000 members thanks to all of you being part of this amazing community. Really love what we do. And we love answering questions about hair loss and hair transplants. A Strong, my consultation is $350, but it covers you for an entire year of care. This is comprehensive, ongoing care. You can do it virtually, or if you're in New York City or Palm Beach, if you do it virtually, you ever need to be seen in person, there's no double charge. You can have as many consultations throughout the year. You're given access to our office cell phone number, so you message us any hour of the day, any day of the week. You don't have to be polite, and that's the level of care we provide. We're providing a very high level of care for our patients, and that's essentially the story. We have actually a lot of patients that come through social, so if you need a consultation, do not hesitate to reach out. Hey, doc, I've been using finasteride for a week with a dosage of 0.5 milligrams. I'm feeling tingling in the nipples. Should I continue? If you're feeling any side effects, you stop. I have not heard of tingling in the nipples before. That's a first, but I've heard tingling in the groin. So I would stop the medication. You might want to go back to your doctor. And what I do with my patients is we microdose the medications, meaning that instead of taking a daily dose, especially for male patients, I microdose and then side effects don't happen. Yes, I do online consultations. So even if you live in Virginia, you can book. You just go to kopelmanhair.com or you can book on my website. There's a link that says schedule, and you can absolutely get started with a consultation. So yes, hello, doctor. I did a blood test. Everything was normal. I don't have any deficiencies. My DHT was 400. Is this good? I lost a lot of hair every day, even though I don't have any scalp condition. It's possible that you have telogen effluvium, a temporary hair shedding condition that happens because of stress that happened 3 months before. It could have been from a loss of a loved one. Maybe you had COVID. Maybe you lost a lot of weight because patients are on Ozempic and Wegovy now. Anytime you lose more than 100 hairs on a daily basis, if you're losing more than 100 hairs on a daily basis, call me. I will help take care of you. This is called telogen effluvium. It's a temporary hair shedding condition. It lasts 6 to 9 months. If you do nothing, it will regrow. But being on hair loss medications is typically the best way for you to address your hair loss. Okay, and I hope that answers your question. 5 milligrams is used for prostate issues. 1 milligram is for hair. Well, sometimes we can go up to 5, but 1 milligram is where we start with finasteride. Dutasteride is 0.5 milligrams. I'm 28 years old. My hair is thin so drastically. TH was anemia, but I have anemia, but got infusions, maybe stress. If you have anemia, meaning low iron, this is a major contributor for hair loss. One of the number one things that I do for my patients is I sometimes send them for blood work. I want to see, what's your iron levels, your ferritin levels? Do you have a T3, T4, TSH issue with your thyroid, meaning you have hypothyroid or hyperthyroid? I look at your B12 levels. I look at your vitamin D. I look at your iron levels. I look at your testosterone, your DHT levels. Very important to get a baseline understanding of where your hair loss is at, because if you need to supplement with anything, we will find ways to add things into your diet so that you can properly address your hair loss. This is critically important. It's not always necessary to do a blood test, but sometimes it can be very insightful. Good morning, Yoga with Cayenne. Good to see you. Thank you. I got 2.5. He told me he did not do the whole thing, even though it says. I'm not sure what your question is, Angie, but I'm assuming you're having a conversation in the feed, but more than happy to answer more of your questions. Thank you, everyone who's joined. Good morning. This is Saturday morning in New York City. Amazing, brilliant sense. I can't wait for you to try it. Yoga with Cayenne. If you want me to take care of your husband, you can always book a consultation. More than happy to get him started on the right routine. If anyone wants to try the Root MD hair serum or the Root MD shampoo, these pair beautifully together. They're really great. And I'm really excited in 2026, we're going to have a conditioner that comes out that's going to pair really well with the shampoo. So my goal with Root MD is we want to develop the best natural solutions to address hair loss in the world. The best natural solutions to address hair loss in the world, and at the same time build the most supportive network in the world for Root MD. I'm thinking, by the way, of starting a Reddit forum for Root MD so patients can post pictures and ask questions. If you think that's a good idea, I'm more than happy to do that. Will caffeine shampoo help with minoxidil? I'm not a big fan of caffeine shampoo. I think caffeine has minimal impact and it improves blood circulation to the scalp. What you want to look for in a shampoo is things with natural DHT blockers. That's basically the critical thing. Natural DHT is going to miniaturize hair. Minoxidil is good because it helps thicken the hair. What percentage of patients get 2 hair transplant surgeries? So if you're in your 30s, you get a hair transplant, it's very common for you to explore getting another hair transplant maybe when you're in your 40s or your 50s. It's about every 10 to 15 years you might think about getting another one, but the critical thing is to retain results from your hair transplant. Medicine is critically important. Now, this week was a very busy week for me. I did 4 hair transplants back to back, a full day of patients on Wednesday and Thursday. I worked Saturday, Monday, Tuesday, Wednesday, Thursday. I worked every day, actually. It was a very, very busy week, Part of the reason was because I was in Brazil before that for 2 weeks doing hair transplants. I perform both FUE and FUT hair transplants. 50% of my patients are female, 50% are male. I do scalp hair transplants. I do eyebrow and eyelash hair transplants, and we do giga hair transplants at our office. The root cause for male pattern baldness, yoga with cayenne, is DHT, dihydrotestosterone, which miniaturizes hair. And so that's why it's critically important for patients to think about being on DHT blockers. Dutasteride and finasteride are great options. Those are oral medications. There's also a topical dutasteride that I like from a company called Zion, XYON, that I find to be very effective. What are the great questions can I answer for all of you? These are really good. What are the PRP treatments, Rochelle? PRP is platelet-rich plasma, where we take blood from you, we spin that blood down, we isolate growth factors, and we inject that to the scalp. It's very, very much like well, the critical thing to understand with PRP is there's a lot of variability. So if I take blood from you on a Monday versus a Friday, if I take your blood versus my blood, different levels of growth factors. I like PRP. It's a good option for patients. It's if you're breastfeeding, you're pregnant, you don't want to use any pharmaceutical medications, but a more effective way to get injections to the scalp is with mesotherapy, MESO therapy, and that's specifically with dutasteride. I find that to be the most effective. Can a bald crown grow back hair with medications and no surgery? No. If you've lost hair follicles, no matter what you rub there, no matter what magic potion you rub on that scalp, nothing's going to grow. That's the critical thing for you to understand. Critical thing for you to understand. Okay. What are the great questions? We have someone from the Philippines that joined today. That's amazing. I'm so appreciative. 0.5% topical finasteride too strong. I'm not a huge fan of topical finasteride, though sometimes I prescribe it. I like topical dutasteride. Why? Because finasteride can get into the bloodstream much faster. Dutasteride can stay localized because it's a larger molecule. What are natural blockers? Okay, A strong. Natural blockers are saw palmetto, rosemary oil, pumpkin seed oil. By the way, all of which are in our hair serum. There's also something called EGCG, which is an extract that also acts as a natural DHT blocker. When you use this, you only have to put about 3 to 5 drops in your scalp. You rub it onto your scalp, and then you rinse and wash this off before a shower, and that will help with addressing hair loss. How long before our products start to take effect? 4 months. With anything that you start, whether it's pharmaceutical medications, whether it's topicals, whether it's natural things, 4 months to start to see an improvement. You have to be patient when it comes to hair growth. It was very funny, actually. Someone left a review that they started using our shampoo, and 5 days later, they said, "I don't see any hair growth yet." Well, of course you're not going to see any hair growth yet. This takes 4 months for results to come in. It's laughable when you see a comment like that. So that's why we don't have 5 stars. We have 4.9 because someone didn't get hair growth in 5 days. Well, sorry. No one's going to tell you get hair growth in 5 days. I don't believe that. And actually on our bottles, at least on our hair serum, it says results may take up to 4 months. Individual results may vary. Okay? So, is it best to take pumpkin seed in palmetto or put it on your scalp? You could do both, actually. You could use a topical serum, or you can take oral saw palmetto pumpkin seed. Either or is an option. I don't see issues with either approach. Really good questions. Thank you, everyone who's joined this morning. I want to thank everyone. We have an amazing community. We've had over 1,000 people join so far. So this has been quite interesting. If you have any questions about hair loss or hair transplants, do not hesitate to ask me in the comments below. How to treat if the cause of hair loss is autoimmune. Well, okay. So an autoimmune condition, there's a few autoimmune hair loss conditions that I treat. One of them is alopecia areata. This is where you can get circular patches on your scalp, sometimes on your beard if you're a male patient. This is where our own body is attacking our hair follicles. To treat this condition, you have to use steroid injections. Sometimes you have to use a drug called Olumiant that acts as a JAK inhibitor to address this condition. There's also LPP. There's CCCA. There's a lot of different hair loss conditions. There's also FFA, frontal fibrosing alopecia, that might have an autoimmune component to it. And again, the treatment options are very similar. We use steroid injections and we use JAK inhibitors to help address hair loss. There's another great question that came in about Alma Ted. Hansel Scott, good to see you back. I know you're one of our amazing members of this community. So when it comes to Alma Ted, the critical thing for you to understand is this is using red light therapy, essentially, laser therapy to stimulate the stem cell bulbs to grow. It takes multiple treatments. This company calls me every day of the week, telling me to sign up for and purchase their $150,000, $200,000 machine. But I think there are a lot more effective ways to address hair loss, and even more effective non-invasive ways to address hair loss without having patients go through the Alma Ted approach. If I switch to topical DHT blockers, will I experience the dread shed? I don't anticipate you will. Most of my patients don't have any shed, actually. How many days are you out of state? How many days do your out-of-state hair transplants need to stay in New York or Florida? We like you to come the day before, and you stay the night of. So 2 days. You have to stay 2 days in the area when you go for a hair transplant, whether you come to our New York office or our Palm Beach office. What other great questions do you have? So the Alma Ted also uses some red light stimulation as well. So it has a certain wavelength of light that helps stimulate the stem cell activity. What are the great questions? How does mesotherapy or any dutasteride treatment? How does mesotherapy? Well, Hensel, this is what happens with mesotherapy. Mesotherapy, we use dutasteride, and we inject dutasteride onto the scalp. It's 1, 2, 3 treatments in a row, and then it's every 2 or 3 months after. If you're consistent with treatments, you're going to start to see really nice results. We have had not one patient stop mesotherapy treatments because they've seen an improvement, a nice, effective improvement doing mesotherapy. With PRP, though, you can get some variability where patients are not going to stay on treatments as long. Then would dutasteride in conjunction of the TED machine be effective? I'm considering. You could do both in conjunction. There's nothing wrong. Doing more is not necessarily bad, but the question is, at some point, is it necessary to do everything? I do believe that mesotherapy is a lot more effective than doing TED med. Okay, that's definitely where my stance is. Can stimulant medications for ADHD cause hair loss? Absolutely. When you start hair loss medication, sometimes it can cause a telogen effluvium, a temporary hair shedding condition, where our own hair follicles will fall out because of the medications that you're on. Usually this lasts 6 to 9 months. You can go on hair loss medications during this period of time to re-stimulate new hair growth. Thank you, Serene. Thank you for all your beautiful comments. Thank you. Serene is one of our amazing community members, happens to be a patient of mine, and might also be doing lives for RootMD at some point, which is exciting. Once you are shiny bald, are you out of options? Pretty much, Sean. There's an option for wearing a toupee or a wig, but yeah, if you're bald and you have no more follicular growth, that's it. You're done. Do you offer PRP during an FUT? Yes, we always do. We basically always do PRP for our patients when we do hair transplants. We take blood from them before the case starts. We spin that blood down, and then we inject the PRP at the end of the case, and that helps with helping with re-stimulation and new growth. Okay, what other great questions can I answer for all of you? Thank you everyone who's joining. I'm so appreciative. Doctor, it feels bad when losing hair and eyebrows. Yes, losing hair in your eyebrows is absolutely very distressing. I do eyebrow hair transplants. You can use Latisse or minoxidil on those eyebrows, Rochelle, and that is an option when it comes to addressing your hair loss. If you're joining for the first time, welcome. My name is Dr. Ross Kopelman. I'm a hair transplant surgeon based out of New York City and Palm Beach, Florida. I do virtual consultations with patients across the country. My consultations cover you for an entire year of care, and I see patients in New York and Palm Beach. And I love what I do. This is, I get up early in the morning to educate patients about hair loss and hair transplants. I'm just getting on here early before I start my morning. It's Saturday, so I'm not working today, thank gosh. But I figured, I go on here live for a little, just to educate everyone a little bit about hair loss before I get my morning going and I enjoy the weekend. I hope everyone's going to do something fun this weekend. I heard that Latisse can cause dark circles around the eyes. Is that true? Latisse can cause some fat atrophy and also potentially cause changes to your iris. But you got to be very careful. As long as you use it in the right spots, you are good. You don't want to use a lot of it. How can you tell what type of hair loss I'm doing during a virtual consultation? So, Stephanie, when you submit, we give you a medical intake form. You fill out your entire list of conditions that you have. You upload your photos. We can get a very clear idea of what type of hair loss you're experiencing, whether it's caused by hormonal issues, whether it's caused by maybe a telogen effluvian. And additionally, we send you for a blood test if necessary. And yeah, about 60% of my patients start with virtual consultations. We're able to get a very good idea about what's going on with your hair loss. So yeah, it's a very effective way to remotely see you're able to see me remotely without having to come in person, and you're never double charged. So if you ever needed to come into our New York office, our Palm Beach office, we have no issues. And I have patients across the country. I have a lot of patients in California, Texas, the Midwest. I just had a patient who's from LA who flew in for mesotherapy treatments. So it's amazing. I have an amazing community of patients, and that's part of why I do this. I love educating patients about hair loss and hair transplants. And I wasn't into virtual consultations, but until I tried it out with Dr. Ross. See, well, and it was very effective. That's the whole idea. You're getting someone who's supporting you through your hair loss journey. And if you're experiencing hair loss, today is the day to address it, not tomorrow. Is minoxidil with biotin a good product? Biotin deficiency is basically non-existent in the population. Heed my advice. Biotin deficiency is non-existent in the population. Basically, non-existent. Okay, so it's not necessary to take biotin-only supplements, biotin-only pills. If it's incorporated into something else, fine, but it's really there for marketing than anything. It's going to be minimal in terms of its impact when it comes to addressing hair loss. There are a lot more effective things like finasteride and dutasteride, minoxidil, sometimes spironolactone that prevents the binding of DHT to receptors. And then, of course, there are natural things to address hair loss as well. Thank you, everyone who's joined. I'm so appreciative of everyone who's joined this community. We are 15,000 members strong. Can you imagine? 15,000 members strong. 7 months of dutasteride, no growth. Continue shedding. When do I call it quits in terms of hair growth? Yosef, I think we should probably send you for a genetic test. It's a swab of the mouth. We can see if you're even a good responder to dutasteride. Because sometimes patients are taking medications when they don't need to be taking medications. So a genetic test is always a good option, especially if you feel like after 7 months you've had no regrowth. The other question I'll ask you is, have you been on oral minoxidil? Because oral minoxidil is going to help thicken the hair. The other thing to think about is maybe the dutasteride is actually working, right? So you can't see those little baby vellus hairs with your naked eye, but I have a trichoscopy device that I measure the hair follicles, and I can see changes in the diameter and growth. And maybe actually it is working and you don't realize it, because a lot of things, what happens to young guys is they'll take the medications, they'll get an improvement, and then they'll plateau and they'll think it's not working. They'll stop the medications and then they're going to regress to where they would have been had they never been on hair loss medications. I'm lagging bad. Let's see. How's that? How am I doing that now, Noonie? Am I lagging now? Am I doing better? What are the great questions can I answer about hair loss and hair transplants? Feel free to ask me as many questions as you want. Can you switch from oral finasteride to topical spray? Also, in the topical combines with minoxidil, but already taking oral. Okay. Yes, you can switch. There's no problem with switching from oral finasteride to topical. I like topical dutasteride though, much better, Marissa. And yeah, the combos, I'm not crazy about combos. I like topical dutasteride if you're going to switch to something from a company called Zion. And I hope that answers your question. I can prescribe Zion for you if you do need it. Doc, what's your take on using a topical solution with minoxidil, saw palmetto? Here in the Philippines, we have a local product that contains both. I think that's an option. It's an option. You can do that. The saw palmetto will act as a natural DHT blocker, and the minoxidil will thicken your hair. So that's a really good question that came in. The ideal dosage for finasteride for beginners is 1 milligram. 1 milligram. Can we start with topical dutasteride versus oral? Absolutely. You can start with topical dutasteride. I use a topical dutasteride on my scalp every single day. Can I do anything to slow down receding hairlines? John, hair loss medications. Keep talking about it. I hope I'm not a broken record, but it's dutasteride and minoxidil are the drugs that are going to be the most effective to do that. Okay, am I lagging? Am I good? Am I coming in slow? I just want to make sure that everyone can hear me clearly. I hope I'm doing a good job answering your questions about hair loss and hair transplants. Because I love this. I love answering your questions. And they're really good questions. I get really kind of detailed questions sometimes from patients from around the world. Where's everyone calling from today? Anyone from New York City? Anyone from Palm Beach, Florida? Anyone from Miami? Where are you from? Let me know in the comments. I want to know if we have any international patients. Would love to know where everyone is calling from. Amazing. We have someone from Poland. Unbelievable. Boca Raton. Well, you can come visit us in Brilliant Sense. You can always come to our office in Palm Beach. I'll be seeing patients next week on Wednesday at our Palm Beach office. Should I get a full panel iron blood work or just start ferritin along with zinc and B12? So someone just asked me about vitamins. So Rochelle asked me about vitamins and Pickup Cup. It's all kind of connected. Always good. And we have someone from England. Amazing. I think that's the first person we've had from England in a long time. The thing that you have to understand is getting a blood test is very important because that tells us what you're deficient in, what vitamins you're deficient in, whether you have a zinc deficiency, a B12 deficiency, an iron deficiency. So always blood work first before running to take a multivitamin. Sometimes patients are taking vitamins when they don't need to be taking vitamins. That's a very important thing for you to understand. We don't charge per graft. We charge, and by the way, charging per graft is complete bullshit. Okay, excuse my French, but essentially what happens is a follicular unit is made up of 4s, 3s, 2s, and 1s. Okay, so when we take hair from the back of the scalp, what the practice can do is they can split the graft in half. So they pull out a 2, they're going to split it in half, and they're going to double charge you. So we don't charge per grafts, per hairs. What we do is we charge based upon small, medium, and large. Are we doing a small case, a medium case, or a large case? And the thing is, every person has a different caliber of hair. We will take as much hair as we can take safely. And the reality is, you always need the same amount. You need the same amount of people helping with the hair transplant, regardless of the size of your transplant. So that's basically the story. What are the great questions can I answer for all of you? I'm more than happy to do that. So if you have low ferritin, yes, that can be contributing to hair loss. And high ferritin absolutely can signal maybe there's an autoimmune condition going on. There's some underlying issue going on in the body, but really low ferritin is a big signal for anemia. And that can be a contributing factor for hair loss, 100% without doubt. We'll start the long hair FUE in your office soon. Yeah, we will be doing direct hair FUE in our office. Long hair FUE is really great if you're doing eyebrow hair transplants, but a direct extraction is more ideal if you're doing longer cases. How many months should I stop taking finasteride before my wife and I start to conceive a baby? Very good question. I love that question, Wynn. So you want to stop 3 months before a planned pregnancy because there's some evidence of decreased sperm and semen count. However, I've had many patients who have been on DHT blockers who never stopped the medications and they had multiple kids. It's just that I'm a little more cautious. You can then resume your oral medication after your first trimester. And that's a really good question. What tests should be done before a hair transplant? So sometimes we don't send patients for blood work because they're healthy. But if you have a cardiac risk, we want to get a clearance, an EKG. Sometimes we'll send blood work. It really depends on your medical history. My body can't handle finasteride. What else can I do for male pattern baldness? Well, if you're taking a daily dose, maybe you need to microdose the drug. That's something to think about. Or use a topical dutasteride because you still want to have a DHT blocker. The other thing to consider is using a natural DHT blocker. This has saw palmetto, rosemary oil, and pumpkin seed oil in our hair serum. When you use this, you leave it on 30 to 60 minutes and then you wash it off in the shower. Do I need to look at your website to go to arrange an online consultation? I'm fairly new here. Yes. And from the UK, I have patients from the UK. So just go to our website and you can book directly there. Absolutely. There's a link for you to book right on that site. And we can do a virtual consultation tomorrow if you want. My body can't handle. Okay, is the average FUT 2,000 grafts? Typically, 2,000 to 2,800 grafts is what we can do with an FUT. Yeah, that's a good idea. Now, the only thing with an FUT is you're flying blind. You don't know how many grafts you're taking out, but it is a very good approach, especially for black female patients, because the strip comes right out. You don't have to worry about the curl, and the extraction is much healthier. Okay, what other great questions can I answer? Is Hasuko minoxidil good? I'm not familiar with that brand or what Hasuko is, but I will put that down on my list. I always have a list. I'm always learning new things from all of you about different products that you're using. I'm more than happy to look it up. And next time I'm here live, I will answer those questions. Okay, what other great questions can I answer? Is finasteride teratogenic, correct? No risk for female partners. So for men and women, you always want to stop 3 months before a planned pregnancy. I put a lot of female patients on finasteride and dutasteride, as well as male patients. It is teratogenic if you're taking the medication once you're pregnant, but that's why I have female patients stop 3 months before a planned pregnancy. Okay, and that's critically important. But the medications are very safe otherwise. Doctor, I just had an iron transfusion yesterday. I had vitamin deficiency. You name it, it's a lot. Rochelle, I advise you to set up a consultation with me, and I can get you started. We'll take a look at you. When I see you, I run a family practice. My father's a facial plastic surgeon and a hair loss expert and a hair transplant surgeon. My sister's a dermatologist and a hair loss expert and a hair transplant surgeon. This is what we do. This is our bread and butter. This is what we do day in, day out. I wake up in the morning, I dream about this. I go to sleep and I dream about this. So we see a lot of complexities. We love the fact that our practice is not just doing hair transplants, but we're treating medical hair loss. And I find it very rewarding when I help patients who are struggling with their hair loss, figuring out ways that they can address their hair loss. I love the complexity, the puzzle of helping them with their hair loss. And that's what we do. This is our level of expertise. The other thing you have to understand is I'm very adamant about educating. That's why I spend a lot of time making videos and content because, and I have a podcast called The Hair Doctors. I interview some of my top colleagues around the world, and we share ideas about different hair loss conditions and approaches. And I'm always pushing the limits forward in terms of treating hair loss. Red light helmets are a good option for some patients. And Rochelle, if you want a specific recommendation, message me after the live. I'll give you exactly the red light helmet that I like. And it can be very effective. You just have to be consistent when you use it. Hello, doc. My problem is my hair loss. Well, that's why we're here. We're all here talking about hair loss. So if you have any questions about hair loss, please feel free to ask away. Everything starts with hair loss medications, and that's basically the critical thing for you to understand. If I take hair loss stuff, will it make me less libido? Well, 1 out of 10 men have increased libido. That means increased sex drive. Interesting enough. And I have a lot of patients that come in and say their sex drive is higher. Most men have no change in sex drive. I would almost argue probably my libido is a little higher. 1 out of 100 men have decreased libido. So that has to be broken down into psychological, by the way, or if you have an underlying erectile dysfunction, and then a small percentage of those patients will actually have some level of libido. But if you microdose the medications, guess what? No issues. And I have so many men on these medications, they don't have issues. How often do you recommend using it? Well, you really should follow the regimen of that particular brand. So I have 3 or 4 red light helmets at my house, believe it or not. Every single one of them has a different protocol. 30 minutes, 15 minutes every other day, every day. Just follow their protocol. And that's what my recommendation would be. Any point try natural DHT blockers or straight to the strong stuff. At the top of my pyramid is the strong stuff. I'm not going to tell you that natural is going to be better than pharmaceutical. That would be lying to you. I'm not here just to sell you. I'm not here to sell you something. I'm here to give you options. So at the top of my pyramid is going to be dutasteride, finasteride, minoxidil, topical dutasteride from Zion. And then, of course, you can think about natural things. You can try our hair serum. You can do this in combination with pharmaceutical medications. This is a great combo. You use this 30 to 60 minutes before a shower, and then you rinse it off with the Root MD shampoo. So this combination works. What is FUE? FUE is follicular unit extraction. I do this all day long. I did 4 FUEs this week. We take individual follicles out from the back of the scalp, one at a time. It's a very meticulous process of popping out hair follicles from the back of the scalp. So really, really good questions. I love what I do because half the time I'm doing hair transplants and half the time I'm treating medical hair loss. I can't beat it, and I've helped thousands of patients answer questions from around the world. At least for how long should I take oral dutasteride and take advantage of its results before getting a hair transplant? Friends, friend. I hope I'm saying your name correct, Francis. I would say 4 months. You got to, it depends on your age, number one, and usually, yeah, being on hair loss medications before a hair transplant is always a good idea. FUE is done after FUT? No, you could do an FUE or an FUT. The most common way that we perform hair transplants today is with FUE. FUT is where we take a strip from the back of the scalp. I do both in my office, and yeah, that's basically the story. I went to Turkey, 6,000 grafts. I didn't do too much research. How did the results come out, Big Stan? That's a big hair transplant that you had. Can pattern alopecia go away? Pattern alopecia? Well, you have to be on hair loss medications. That's basically the critical thing for you to understand. That's, being on hair loss medications can help decrease the rate at which you're going to experience hair loss. It could reverse some hair loss, and that's essentially what the story is. So if you're joining for the first time, welcome. My name is Dr. Ross Kopelman. I'm a hair transplant surgeon. If you can't tell from my sweater that my sister bought me, which is very nice. She bought this as a birthday gift, but I wear it all the time. I spend a lot of time educating patients about hair loss and hair transplants, and I practice in New York City. New York City. Is anyone from New York? Let me know in the comments below, please. I want to see if any New Yorkers are out there. I also have an office in Palm Beach, Florida, 2 very, very fancy addresses. And I do virtual consultations with patients across the country, in the United States, and really in the world. I have patients everywhere. And it's amazing. And we built this RootMD community from scratch. We are now over 15,000 members. We're going up and up and up. And I believe we're eventually going to hit 20,000 members. So, by the way, if you're joining, and I'm in Palm Beach from Long Island. Amazing, Justin. Well, you can always come into our office if you needed a consultation. I need help from the community. And what help I need is if you see other videos on the internet about hair loss or hair transplants, tag RootMD. Why? Why do I want you to do that? Well, we want to be part of the conversation, okay? As a doctor, I want to be able to look at other videos, give my opinion, my thoughts. If you have questions while you're watching other videos, tag RootMD, 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 RootMD. Please, we are building this community. We want this to be the most supportive community in the world when it comes to hair loss and hair transplants, and we want to dispel any misinformation out there. So do your best to tag this whenever you see videos on social. Doc, where's the topical PP405 in development? How promising is it for curing baldness or just the treatment for hair growth? Well, Win, that's a very good question. A lot of patients were asking me about PP405 a couple of weeks ago because it was trending all over the news. It's a drug that's being developed out of UCLA through a pharmaceutical company known as Pelage Pharmaceutical. And the whole idea is that we're stimulating stem cell activity at the hair bulge. Why do we know that we can do that? Well, they're using a marker called Ki-67. And it's exciting because we haven't had a new hair loss medication in over 30 years. Finasteride was approved in 1997. Minoxidil was approved in 1988. That bottle is older than me. It's 37 years old. I'm 36. So we need new hair loss medications. However, it's in phase 2A clinical trials, and it's far away from being released. So we need to be patient. It's going to be probably another 2 years until it's released. And I don't think it's going to be a drug that's going to cure baldness. I think it's going to be a drug that's going to be used in our regimen to help address hair loss further. Yes, Big Stan, minoxidil used to be used as a blood pressure medication, but at a very low dose, we know it helps stimulate hair growth. And but that's why I always tell patients to take a half a glass of water with their minoxidil so that they don't feel any dizziness. Now, some patients are going to be very sensitive to these medications and they can't take it. I want to get another one. Do you do black hair transplants? Yes, I do black hair transplants, Big Stan. But you have to understand with black hair, it's one of the areas that we specialize in, but there's a finesse to black hair. There's a curl to that follicle. So you got to be very cautious about how you extract. Transection rates are much higher with Black patients than with Caucasian patients because of that curl that's underneath the skin. But yes, we do Black hair transplants. And I just did another consultation yesterday with a Black patient who is an officer who I believe will be coming to me for a hair transplant in the coming weeks. Okay, what other great questions can I answer for all of you about hair loss or hair transplants? We spent a solid 54 minutes on here talking about hair loss and hair transplants, and you've been an amazing community. So I'm so appreciative for every single one of you who's asked questions about hair loss and hair transplants today. So thank you so much. If anyone needs a consultation with me, do not hesitate to book a consultation. You can go to the page above on RootMD, and you can always book a consultation, or go to Kopelman Hair and book a consultation. We're looking forward to helping you with your hair loss and hair transplants. Okay, what other great questions can I answer for you before we end this amazing conversation that we've had this morning? One of the things that I love to do is I always love to end with a little of my favorite singer. So can anyone guess who my favorite singer is? Yes, Andre Pacelli. Andre Pacelli. I love Andre Pacelli. We'll play some of his music. There we go. Okay, well, look, I spent a solid hour educating all of you about hair loss and hair transplants. I've answered a lot of questions. Hi, doctor. I'm new and subscribed. Thank you so much. Love your shorts. They're very informative. Finasteride, dutasteride, minoxidil. Where should I start? Well, you can start by doing a consultation. That's number one, and I can guide you. But I think at the top of my pyramid, it's always dutasteride mixed with minoxidil, and I find that to be the most effective way to address hair loss. So thank you, everyone who's been part of this community and joined. I'm using minoxidil and using pumpkin seed, palmetto. My shedding is gone. Can I stop minoxidil? It's good to maintain minoxidil. Minoxidil is going to thicken your hair. When you're using hair loss medications, it's a lifelong kind of commitment to being on hair loss medications. Nudie, can I take dutasteride with spironolactone for TA hair loss? Yes, you can. You could also think about adding minoxidil as well. I have both topical DHT blockers. Can I use? If I had both, I wouldn't use too much. It depends if you're using a pharmaceutical. I would use dutasteride. Lean heavily on topical dutasteride. Yes, it's Pacelli time. Everyone knows it's Pacelli time. I always love to end my lives with Andre Pacelli. Beautiful music about love. What about gray hair? It started when I was 12, and now hair looks like 60, and I'm 36. You got to diet. Unfortunately, there's nothing that we can do to address gray hair because it's about stress and genetics. Can you take pumpkin seed oil while pregnant? Pumpkin seed. So you really want to avoid all natural DHT blockers even when you're pregnant. What you can do when you're pregnant is you can sometimes red light therapy is good. Micro needling, microblading. Micro needling of the scalp. PRP, multivitamins. You really want to avoid natural DHT blockers during pregnancy. Even though there's really no proof that they cause any issues, that's my medical advice. Another doctor might feel differently, but that's my take. And red light therapy is a good option for you to be on. Where were you in an Italian tenor in your past life? No, I was not. But I love beautiful music. I love beautiful music. Okay, what other great questions can I answer? I always end with Andre Pacelli. Kind of marks the end of this beautiful relationship we're all building. I want to thank everyone who's joined the RootMD community here on TikTok. You've been amazing. And I want to thank everyone who's purchased the RootMD shampoo or the hair serum. We're so thankful to have you part of this community. We really are. One micro needling with the Dammer stem, not the roller. You could use either one. You just got to be very careful. I'm not a big fan of using them because you got to make sure to clean them. You don't want to overuse them. But yeah, that's basically the story there. What other great questions can I answer for all of you? Thank you so much who've joined. I hope that everyone has a beautiful day. You get to get off of social a little, and you get to exercise, spend time with family and friends. I plan on going to shul this morning. Temple. Some people call it Temple Shul. But I'm going to head to Shul and right after I get off the live. Last song. Will you be offering any Black Friday specials on the shampoo? We don't do specials. We are going to have a combo in the future with our shampoo, conditioner, and hair serum, but we're very much like Apple. Apple never discounts because we're a premium. We're a premium, and that's what our goal is. We want to deliver care at the highest level. I'm sure there will be other people offering 50% off or whatever it is, but if you want something that's great, you don't look for discounts. I do see consultations all the time virtually, so if you wanted to book, just go above, hit Root and D on the bio, and you'll find a way to book with us. There's a link right there for you. What are the great questions? I'm so thankful for everyone who's asked questions. I'm playing Andre Percelli right at the end of the live. Because this is how I kind of decompress. And, look, 90% of the time I spend time educating patients about hair loss and hair transplants. 10% of the time I joke around, and 2% of the time I talk about Root and D and the growth of our amazing community. So, yes, we do prescribe, and we can also order you blood work wherever you are. Definitely in the United States. If you're international, a little more challenging, but we can always help you find a way and guide you properly. So thank you, everyone who's joined this morning. You've been amazing. Thank you for being here. Look how beautiful that is. Come on. We did a solid hour of answering your questions about hair loss and hair transplants. And I hope you have a beautiful weekend. I hope everyone has a beautiful weekend. Don't forget to exercise. Don't forget to call the people that you love. Don't forget to spend time with people that you love. Our baby hairs from 2 months of finesse are from Root and D placebo. I'm not sure what that question is. Pick up. Amazing. Can I get the shampoo in England? Yes, we do ship to England. Gigi, just go to. I'll put the link here so you can purchase it directly. That's where you can get the shampoo if you needed to get it. If minoxidil is giving you a heartbeat, then you got to decrease it or stop it. If you're having some patients are going to be more sensitive to minoxidil. I do Brazilian blowouts once a year. How does this affect when I use? I'm not worried about that. You can do a Brazilian blowout, no issues. It's not going to cause hair loss. The critical thing for you to understand is with minoxidil is thickening your hair. That's the story. What are the great questions going to answer for everyone? I want to thank everyone who's joined live here today. You've been amazing. We did a solid hour together. I hope everyone has a beautiful morning. Go out, enjoy, exercise, spend time with family and friends. Get off the screen. And if you have any questions about hair loss, reach out to me. I'm here to help you no matter what, whether it's with our Root and D solutions or taking care of you as a patient. So have a beautiful weekend, everyone, and goodbye, as they say. This will help. This will help with your shedding. Absolutely. Okay. If anyone has other questions, feel free to reach out. Non mi ricordo come mai entrata dentro c'era stato. Vivo per lei perché mi fa vibrare forte l'anima. Vivo per lei e non è un peso. Thank you, everyone. Have a beautiful, beautiful day. I will be back here live tomorrow.